This is Dr. Tanya Rampersad, ND, and this is one segment in a series on homeopathy. I hope you enjoy it and that you learn something interesting. So I want everybody to know about homeopathy and how fantastic it is. And I want everybody to learn about how to use the remedies for themselves. And if you want to know why I want everyone to learn about this fantastic medicine, I've created another video called Homeopathy for the Coming World that you can also check out. So for the purposes of faster learning and to accommodate everybody, I've selected only 3 remedies out of the many to showcase, and these are 3 remedies that I think most people could use. They would be good for common situations that you would find at home, so you could treat your family and friends with these 3 remedies. So give it a try. When to use homeopathic medicines is just as important as why to use them, especially when you're first starting out. So I would recommend using them in settings where you feel like you can treat yourself safely. So this might be a family setting. You might be dealing with a sprain, strain, relatively insignificant burn of yourself or a loved one, but also in situations where you might not have access to other medical care, such as if you're in the wilderness, say on an expedition, or if you're traveling to a foreign country and you don't have access, you don't have the same access. Say you're on a bus, for example. I find traveling is a great time to use homeopathic medicines. The first remedy that I'm going to talk about is arnica. It's made from a plant, Arnica montana, and this is the premier injury remedy. This is the remedy that I recommend that almost everybody buy just to try it, because it has so much utility in falls, sprains, strains, bruises. So this is the first remedy you would reach for if you suffer some kind of injury, some kind of blow, a fall, etc. So it's even good for instances of a little bit of shock when you've injured yourself and you think you're okay and everybody else thinks you're not, or if you see somebody in that particular situation, it's a useful remedy for that. Now, you are supposed to take it as soon as possible. This is when it works the best. But if you have an injury that's still bothering you a day later, for example, you could take it then too, and it probably will be useful. So if you use it properly, what you would expect is an almost immediate reduction in pain, much reduced bruising, or faster healing from bruising, and faster healing overall from the injury. Now, when you get an injury, we'll talk about dosing later, but you can take it every 5 to 30 minutes, depending on whether you're responding to the medicine and how severe the injury is. So, for example, if you get into a car accident and you're on the way to the hospital and somebody's there to help you out, you could take a dose every 5 minutes. The second remedy that I'm going to talk about that I think would be useful is cantharis. And cantharis is made from a beetle, also known as Spanish fly, which has some reputation as an aphrodisiac. And this is a cantharis beetle, but you would not handle a beetle this way if you found one, because they secrete a toxic poison on their shell, and when you come in contact with that, it causes severe blistering. So the rule with homeopathy is what it causes is what it treats. So cantharis is used to treat severe blistering burns. So if this fellow had taken a dose of cantharis immediately after burning himself, he probably would have had much less pain and probably much reduced or actually no blistering. I've seen this work for myself. It's pretty amazing. Now, cantharis is also used for other blistering skin conditions, really bad poison ivy with large blisters, or even really bad sunburns. And the other indications for cantharis are excessive pain. So all the conditions of cantharis have excessive pain. And if it's a burn, there's an absolute need for ice. If it's a child, there will be screaming. If it's an adult, there might just be crying. And also horrible bladder infections. And again, the pain is over the top. The urination is scalding, painful. And there is a kind of horrible and unusual itching of the genitals that goes along with that. The third remedy I'm going to talk about is also an insect remedy, and this is apis. It's made from Apis mellifica, the common honeybee, and what's notable about the honeybee is its sting. And a honeybee sting causes large swellings, heat, redness, and shininess, and sometimes there's a little bit of itching with that too. So allergic reactions respond really well to apis quite often. Even if it's an anaphylactic reaction, apis can save a life if that's your last resort, or if you're, let's say, in the wilderness and somebody's having a reaction and you have nothing else. Apis can and has been known to do the trick. But of course, if you or a loved one has a known anaphylactic reaction, always carry an EpiPen, because if you are relying on a remedy and it doesn't work for you, then you're in a lot of hot water. So yes, be safe with this, definitely. So I would recommend it for, you see some people that have that large, puffy, shiny eye. That would be a good time to use apis. Or bee stings or wasp stings or other bug bites that swell up. Now, dosing depends on the severity of the incident and the response. So what you'll commonly find in a health food store or drugstore is a 30C. And the way you would dose a 30C might be every 30 minutes as needed until you are safe or until you're feeling better. Now, if you take a single dose and it works for you and everything goes away, then that's all you need to take. But let's say you take a dose and nothing happens, and so you think, I should dose again, and you dose again in another 5 minutes and nothing happens. And you try another dose in a few more minutes and again nothing happens. Well, that remedy just will not work for you, and it's time to move on to something that hopefully will. So the important thing to remember here is that when the remedies work, they work really quickly in acute situations, and they work well. And the other thing to remember is that these are just 3 remedies from several thousand. So if these 3 remedies don't meet your needs, if they don't work when you try them, it doesn't mean that the remedies don't work. It means that they don't work for that particular person in that particular situation. So hang on to them or give them away. Don't throw them in the garbage, and try them again. And I hope you do try them and that you have wonderful and fantastic results. Thanks.